Ladies and gentlemen, can we read clearly without eyeglass after the age of 40 or 45 years of old? This is an important subject. Affect every person after the age of 40 in hypermetropia and 45 after in a normal eye. The cause, as mentioned in the scientific books, that the cause of presbyopia or old sight is due to two things. First, the reduce or decrease in the elasticity of the lens that focus the eye. This is the first cause. The other cause, this is the lens. And it is a biconvex lens because it was stretched by zonule to the ciliary muscle. So the decrease in the elasticity by aging is the first cause, as it mentioned in the scientific books. The second cause, they say that these ciliary muscles are involuntary. We can't stimulate it. These two causes are wrong, and I prove it anatomically, physiologically, clinically. How come? How can we read without reading eyeglass? We have to stimulate the ciliary muscle to contract and relax. Scientific books mention that it is involuntary. I have previously authorized a book, Anatomy and Physiology of the Eye, in Arabic language. And I found that there are two important cranial nerves go and supply the ciliary muscle and the iris muscle. These are the third oculomotor nerve via the ciliary ganglia to the short ciliary nerve that reach the iris and ciliary. This is a pure voluntary nerve. The other mixed voluntary and involuntary is the fifth cranial nerve, trigeminal nerve. This trigeminal nerve sends two branch long posterior ciliary nerve supply the ciliary muscle and the iris muscle. If we stimulate these two cranial nerves, we can increase the power of the ciliary muscle and return our vision for good vision for near. The other things that they say that the cause of presbyopia is decrease the elasticity by aging. This is wrong also, because we are, as a surgeon, previously we perform cataract surgery, we remove all the lens. If we remove the lens completely with its capsule, it takes the round shape. Take the round shape. And you can Ask any surgeon, ophthalmic surgeon, and he says yes. So there is no loss in the elasticity of the lens if it is clear, and if the nucleus is not too large, and if there is no previous infection affect the lens. So according to this fact, I try to stimulate the ciliary muscle and the extraocular muscle by a scientific Al-Kasab training method to see clearly and read clearly without eyeglass in old age after 40 or 50. And before you judge for this method, try it and see if it is correct or wrong. I am too old. I reach 70 years. 70 years age, and I do not need to read with the glasses or see the television with the glasses. Why? Because I train my eye to see clearly. How the old scientific person publish a book with the small letters, and there is no glasses at that time. They only use the candle. We have to work our mind and leave these artifact, glasses or anything new that destroy our eye or destroy our muscles. Now we have to perform our scientific training method. How come? First, we have to prepare something essential for the training. The first thing is the near chart. Near chart is a present like this with different size of letter or numbers. This is in English. I make an Arabic reading chart with different size, scientific size, which called near, from N36 to N5 to train. If you don't have this, it is simple that we could use any magazine or book or journal with different size letter and try to train on these letters to clarify and strengthen our ciliary muscle and extraocular muscle. This is important. First, we have to use the reading chart. The other thing, we have to make a follow-up notebook. This is important to know that if our training exercise correct or wrong, what if it is a progress or regress, the cause, we have to put the name, the time and date of beginning the training exercise, degree of the class that you use in reading in the right and the left eye, and the visual acuity with the glass and without the glass. This is important. When we start the treatment, the training exercise, we have 8 essential training exercise, and I will tell you about them later. 8 essential. Each exercise have to be performed for 1 to 2 hours daily. Continuous or interrupted according to his time that he could perform the training for 1 to 2 hours. Each training exercise must be performed for 1 week. Not perform all the training in one sitting, because we have to stimulate the muscle gradually to work, to change the curvature of the lens, to elongate or decrease the length of the eye by the extraocular muscle. This is very important. The progress and the improvement of visual acuity will be gradual. It is like any training exercise to improve power of the body. You need to follow all the instructions by the trainer to gain the best result. So, every day we have to put the time that we start to train, the visual acuity before training, in both eye and in each eye, the visual acuity after we finish the training. Any improvement, we have the number near 36, near 40, or in any journal or book, you read the big letter or the small letter and the smallest letter. This is simple. And every day you have to write in your note what progress or regress in your vision before and after training. After that, we need another thing. We need a closure of the eye, because when we are training face with both eyes, then we have to close one eye and train. If anyone get tired by put his palm on the eye, he could use a small one eye closure that I mentioned before in my previous lecture. How can you take off get rid of your eyeglass and see clearly in the first lecture? Only a small piece, cover it with the paper, cover it with the black cloth and with the string or elastic rope, and make one eye closure. So we have the near chart. We need the near chart, the follow-up chart, and one eye closure. The other need is a good illuminated room with different closure to reduce the light and see clearly for near. Or use a table lamp with low and high increase or decrease the illumination in the 4th or 3rd training exercise. These are important. The other thing is that after we finish this, we start to perform our training exercise. As we mentioned before, and explain clearly how the extraocular muscle in the first lecture of can you take rid of your eyeglass and see clearly. The extraocular muscle can press on the eye and elongate it to make the reading word focus on the retina. because before it is fall behind the retina. We stimulate the ciliary muscle also to contract, to change the curvature of the lens to focus the reading word on the retina. These are important to be known by every person so that he believes in our training method. Don't be boring about all these explanation. It is for you and for my friends ophthalmologists, so that they do not disagree with me, because I speak on a scientific base. Now we come to the essential training method. Either we put good light on the table and start to read from above downward until we reach the second or third line, and try first. The training exercise is the massage method. The massage is done by putting the hand, this side of the palm, on the eyeball, closed eyeball, to do the round massage on both eyes for 7 to 10 times. Then close by the palm both eyes and count from 7 to 10 and open and look. You see that the vision become clear for a while, and you see the blurred letter clearer, then return blurred. By this method, massage method, we stimulate the extraocular muscle and intraocular muscle to work. And by focusing, after that, massage, closer, then focus. Focus to see clearly. Focus and do like close, semi-close of your eyelid and open. Semi-close and open. All these are to stimulate the muscle to focus and clear the letter. In the first week, then we try to make the near chart far and near and clarify and do the massage. It is simple massage method. This is the same method that we perform for taking rid of your eyeglass for distance, for myopia, hypermetropia, astigmatism, and this is for presbyopia. How can we read clearly? The first massage method. Massage, close, focus. Close, semi-close of the lid and open. You see that the blurred letter become clear, clearer than before. Continue on this for 1 hour to 2 hours, according to your time. And write the difference on your notebook. This is the first massage method. Some of the ophthalmic surgeon or doctor say that massage will affect the cornea and the eye tissue is sensitive. Be aware. This is wrong. If you return to the anatomy of the eyeball, the cornea consists of 5 layers, 2 membrane and 3 epithelium, endothelium, and stroma. And the sclera is very strong, the stronger tissue in the body after the eye bone. So, and once we close the eye, the eyelid, we have the superior and inferior tarsal plate that protect the cornea. When we do the massage, the cornea will not affect only the extraocular muscle. So don't believe them. Do the massage if you are if your retina is good. And I will be against any doctor say that I speak wrongly. He have to return to the anatomy and physiology and see how it is good. If not, close and open. Without massage, it is other way. But this is better. If you are afraid, do and close 7 times and then count for 7 from 1 to 7 or 10 and open and fix. This is the important. Our aim is to stimulate the muscle to contract and relax, to focus every letter and the smallest letter on the retina. This is the massage method. Perform it and don't be afraid. The second method is the vertical and horizontal fixation on the nerve chart. If we reach this letter and the line below is blurred, try to do the massage and you will see one letter or word in the nerve chart. Try to focus on this new clear letter on the one above it for 10 times or 20. You will see another letter beside this line. Change the vertical fixation to the horizontal. And continue from this to this fix. You see the third letter. Continue with the massage and semi-close the lid and open until all the line you will see it clearly. This is the vertical and horizontal fixation. If you want to learn more, go to our old lecture to vertical and horizontal or the distant chart. Perform it on the near chart. Not clear, make it near and far. This is the other method, the concentration inside the chart. The other training method, these are three is very essential to stimulate the muscle to focus near reading. The third is the external fixation between the near chart and outside. If you have letter as like this in front of you or a watch, fix on the last letter you see clearly and go to watch the on the watch on the wall and see the big letter and the small letter, the small needle, or any picture. Focus on near and far. This is the external training method. These are essential to train the eye. Each training, the internal, vertical, and horizontal must be performed in 1 week, each day 1 to 2 hours. The external for 1 week, so we have now 3-week training and all fixed in our notebook. You see that your vision is improved from N36 to N9 or N8. You feel sometimes pain in your eye because the muscle is stimulated before it is lazy. And once you stimulate the extra and intraocular muscle, you feel pain. Simple. You can reduce it immediately by doing the massage for until from 7 to 15 and close and count for 7 and 15 and open. The pain is disappear. Any muscle in the body, if it is contracted and pain come from that muscle, we do massage to her. This is the massage, the same as other muscle. Simple. But you have to believe and do it. Don't worry. I train thousands of patients, and all of them throughout your get rid of their reading eyeglass and read clearly. The other training method is to train each eye alone. We previously trained both eyes. Now we put the closure as we mentioned and try to perform all the 3 essential training exercises on each eye. This is to stimulate and make both eyes the same vision for reading. If anyone weak, try to force and increase the training on that weak eye until both eyes are in the same level, and write it in your notebook. After we finish these, we have to reduce the contraction. We previously contract and open. Now we have to reduce it. We read the chart until, make the reading chart at a distance of 30 to 40 centimeters, the reading distance. And try to semi-close. You reach the level that you reach by previous training. Try to open and slowly and clarify the blurred. Open and close until you can open the eye and see the last letter that we read by semi-closing. This is also need 1 week. If you don't understand any training, return to how can you take rid of your eyeglasses and instead of the distance, perform it on the near chart. The other training exercise is to reduce the intensity of the light. Light intensity is very important in reading. If you want to see clearly, even in the beginning of start, use a table lamp, like this, table lamp, and put it on the table, and you can read. If you close it, you could not read. Open the light, you could read everything. With the massage and training, you can read without table lamp. Another important thing to see clearly near in 1 second is using the torch. If you are in the mall and you do not carry your reading glass and you want to know the price of anything, you could not see it because it may be far or small. So only buy one of this is only half pound and put it on the price and you will see it. If you are in the bank or any place and you want to read, you can use it. If you have a drug and you could not read it, only through the light on it and you could read it clearly. This is simple. Try it. And you will see that all my talking is right. If you want to see clearly, go outside the bright light and sunny light. But in the home, use table lamp and do the massage. If you do the massage and strengthen the eye, you could read everything without any trouble. And I am sure you could do it if you hate reading eyeglass. Now we come to all this training on the chart, the 6th training. Now, this is a voluntary stimuli. Now we want to change from voluntary order to a reflex. Like when you try to drive In the first time you don't know how to change the steering and do press on the brake or benzene. By voluntary training, and after we perform the voluntary training, you have to shift to the reflex. After you learn and it become good, you can drive without pay attention to the steering or the brake or the benzene. This is the same. First you fix and try voluntary. Then we shift to the other two training exercises inside the house and at the mall or street. Inside the house, go and see everything to clarify or read it. And at the room or at the window to see and clarify. Or put a torch and make it near and far. You have computer. Put your head near the computer and return and do the massage method. You will learn. You will see that your vision, you through your reading eyeglass and see clearly in all age. If you have the wish to take rid of your near glass, you gain it, I am sure. Outside, if you are at work, you could not do the massage, only close and open and perform it on the laptop or on any small letter. By only close or put your head down and close and open without massage, so that you don't pay any attention. Or take with you the torch. You will see near very clearly. These are the essential training methods. You have to perform every training for 1 week. After you finish, you see that your vision returns to normal. And I am sure that you will gain it if you want. And if you don't have any time to train, go out to the and use the reading glass. And you know that spectacle for reading destroy your near vision. You ask how come? I will tell you. In the first, you were only plus 0.5. After 6 months, you don't see by half. You make 1. After 6 months, 1.5, until you reach to 2 or 3 diopter. How come? How it happened? This is destroy your ciliary muscle, because it takes the function of the ciliary muscle and it become lazy gradually. So be aware that a glass is not good for your eye. This is my advice to you for that. And I wish that you will gain it. After the we finish all the 8 exercises. If we have some remnant weakness in the eye, what we shall do? We do the accessory training exercise. Accessory training is to increase the stimulation of this muscle. There are 4. The first one is the massage each muscle. Simple by this thumb and look down the superior rectus. For this, the lateral, and for this, the medial. For this, the opposite. Up, do like this for 7 times for each muscle. This is to stimulate, to increase blood to come with oxygen, so that it will become more strong. Other accessory is put your thumb like this and in the front of a watch or a picture and fix on your nail and on the watch. A nail and the watch. So that you stimulate both eyes.